It's been a tough week for a lot of people. A couple major icons choose to take their life. It happened this week. Glad you're with us here, folks. I'm Ted Hall.
And I'm Brittany Tarwater. Both Kate Spade and now it appears Anthony Bourdain committed suicide this week. But it's a disturbing trend that's on the rise. More Americans took their lives last year than the number of people who died from opioid overdoses. According to a new CDC report, more than half of those people have never been diagnosed with any mental illness. Now doctors are putting an emphasis on helping people who are struggling to get the help they need.
I hope people pay attention to those around them, that if they see someone who is suffering or acting unlike themselves or despairing, hopeless, withdrawing from social activities, that they check in on them, that they make sure that they're getting the help that they need.
The rate for suicide is its highest in adults between 45 and 64, and while suicide is more common in men than in women, there's been a rise in female suicides.
We want to hear from experts about this, on mental illness, on suicide. It's something that a lot of us feel like we need to talk with somebody about, but it's so difficult to talk about. This is John Kupfner. He's a psychiatrist with Peninsula Clinic. How do you start this? When do you know? What are the signs to look for? There are so many issues here, but from your perspective, what's the most important thing to think about right now if you're concerned about it?
Well, first of all, suicide is multifactorial. There's not one thing that we can look at that says that makes you at high risk. That makes our job very difficult. Things add up in someone's life, and sometimes they just can't take it anymore. So as we heard earlier, half of the people that commit suicide have a diagnosed mental illness. The other half do not. That doesn't mean they weren't suffering from something. Maybe there is a stigma of the mental health system. They didn't come in and get help. So if you're worried about somebody, the things you're going to look for is when somebody really becomes hopeless, they feel like things are just never going to change. They're going to feel bad, and they're going to feel bad forever, and there's no hope that anything will change or help them out. That's when they become much higher risk. If they have serious medical illness or things that are life-threatening, or if just all those things in life come crashing down at once, loss of job, divorce, just all those things that make people feel worthless and hopeless and helpless.
If we have somebody we're concerned about, is it crucial just to, no matter how uncomfortable it is, come out and ask, break the ice and start the conversation?
Absolutely, because you don't get a chance to ask that question if somebody's successful at this. And there is treatment, there is intervention. So if you can get somebody to an emergency room, they can be seen by mobile crisis, assessed by the physicians there, see if they need acute treatment. That can be done. You can have the police do a safety check of someone's house if you're just worried about how they're doing. Or if it's something that's just kind of gnawing at you and you know who their primary care doctor is, you can drop a note off at their office, let them be seen by their primary care doctor, where they can do depression screenings, bipolar screenings, make sure that somebody's safe at home.
So if you're concerned about somebody, start the conversation, get talking about it. What about people who maybe close themselves and not realizing it? Are there some triggers people need to look at within their own minds and with what they're feeling?
I think the biggest one is the hopelessness. Like, what we look for is what we call future thinking, right? Yeah. So like, you have to still somehow be able to see some way in the future I will get out of this, or I can experience joy again. When that's completely gone, you need help.
Dr. Kupfner, sure appreciate it.
Thank you
very much.
Thank you.
Brittany.